You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with varicose veins. And with us, we have an expert on the topic, board-certified phlebotomist, Dr. Nichols. Okay, Dr. Nichols. Now, you brought more photos, a lot of photos here.
Oh,
and
yes.
So this, as a recap, if they're just tuning in, they don't have to go to the hospital these days.
That's right. We can do it right in the office.
Right in the office. Okay, so let's take a look.
This patient was actually referred to me from another doctor because he didn't know how to get rid of her varicose veins. She is an executive in her 50s, and she would have pain and swelling in her legs, and she also told me she's a grandmother, and she's ashamed to wear a bathing suit. She had a big trip planned with her grandchildren, and she wanted to be able to wear a bathing suit next summer. So other than the pain she was having, the way that her leg looked really bothered her. So with her, we did the ultrasound, and we found out immediately what the problem was, and we fixed that with the venous closure. And we also did some vein injections, and this is her photos a month later.
Very nice.
And
Very
she
nice.
had no pain, and now she was ready to plan her trip with her grandchildren. So she was ecstatic. She told me this would be the first time that she had on a bathing suit in over a decade. But an interesting point is that not everybody comes in with symptoms. A lot of people come in because they just don't like the way that their legs look. And once we actually ask them the questions, we're going through the questions, tell me, how often do you have to put your legs up? Are your ankles swelling? Do you have discoloration or brown spots down by your ankles? Have you ever had an ulcer in your leg? Are your legs fidgety at night, something called restless leg syndrome, where you just can't get your legs comfortable? And what they realize is that they're really having symptoms, but they never put two and two together that this was due to their leg veins.
Interesting.
And these are the kind of patients we'd like to see more of. I'm telling you, if you have varicose veins, then you have something going on that's not normal in your legs. If you're 40 years old and your legs feel heavy and you're having pain in your legs, that's not normal. If you have restless leg syndrome at night and you can't sleep, that's not normal either. So if you're only 50 years old, you should be able to walk and not have pain or swelling in your legs.
Do they think it's just part of normal aging, just to start having tired legs?
Some people do. They think that this is just the way life is going to be, and no one has ever told them or even knew that this was due to the vein problems in their legs. I see people who, after we treat them, their shoe size goes down by 2 sizes.
Really?
Because their feet and their ankles aren't swelling anymore.
Interesting. Very interesting. Okay, now you have a very graphic photo here. What are we looking at there? I mean, that's an ulcer.
This is an ulcer of the skin. This is an unfortunate gentleman who...
Is that below the knee? Is that what we're looking at? What is that?
This is on the outside of the calf on a gentleman.
Oh, boy.
Isn't that lovely? And he was thrilled when we made that go away. But he had been treated for the last 2 years in a wound center in a hospital for this and was told that it was doing okay.
Like, how do they typically treat something like that?
Typically,
across America.
Typically, they treat the surface of it. They'll clean it. It's called debridement, taking out some of the dead tissue, put them on special dressings, maybe that have silver in them, antibiotics, but they never address the root cause, what's actually causing the ulcer.
So what was causing this one?
This is an interesting one, and this is a photo, actually, of the same ulcer, and there's a marker there that shows where there's an abnormal vein underneath that ulcer causing that ulcer. So until you fix that vein, the ulcer is never going to stay healed.
How did he hear about you, by the way? Because he's getting the wound center treatment. How does he hear about this?
He heard about me through a physical therapist who realized that he was getting nowhere with his veins and with his ulcer and recommended me for treatment.
How soon, by the way, in your mind did you think, I'm going to take care of this? I mean, what goes on? What's the process?
I guess my immediate reaction was, oh my goodness, this poor guy has suffered for years with this and no one has ever really treated the root cause. But I knew pretty much when I first saw him that we could treat this and make it go away.
So what do you tell him? I mean, do you say it? I mean, look at the ultrasound and say, there it is.
I could look at the ultrasound with him, and within about 15 minutes I could say, this is your problem. It's never been addressed. If we take care of this, I think I can make your ulcer go away.
What does he say when you tell him that? Skeptical?
He was a little skeptical because he'd been through the medical system and been treated for several years and never had results from that. But he said, Doc, if I could get in the swimming pool with my grandson this summer, you'd be my hero.
Wow. Okay, so now the afters. Let's take a look at what...
Okay. We diagnosed this abnormal vein, and we treated that.
How'd you do it, by the way? Which procedure?
We used the venous closure on this vein. And
that's radio frequency.
That's the radio frequency, and he was up walking immediately after that. And he was resuming his normal activities the next day. This is a month later. You can see that it looks nice and healthy and that the wound is getting much smaller. And then this is 3 months later, and it's almost totally healed. Look at the before and look at the after. Look at the difference in that. And that's in 3 months. The gentleman has been suffering for years with this. And he's not alone by any means. They estimate...
It's that common, though, that this is going on out there?
It's very common. Actually, 3 out of every 4 ulcers on the legs are caused by vein problems.
Is that right?
That's right. So that's 3 times as many as are caused by arterial problems.
All right. Now medical doctors will watch this show. They don't like to admit it sometimes. But what do you want them to know about what you're doing over there?
I want them to know that it works. It works better than vein stripping. It's effective, and there's minimal downtime with it. And their patients can usually be covered by insurance. If we can take a look at these people, then most of the time we can help them. And if we can't, we'll let you know.
Okay, good. Now, with this particular after case right here, it's going to get better than that? I still see something going on over there?
2 months later, he was in the swimming pool with his grandson, and it was totally healed.
Is that right? I mean, do they call you? Do they tell you? Do they send you a note?
I saw him back in follow-up, and he brought his grandson in with him.
And now they could go swimming. Do they get frustrated, by the way, a little bit? Do they say, Doc, how come everybody doesn't know about this?
Oh, they do. And they're some of my biggest raving fans, that they want the world to know that this is something that doesn't need to be suffered by people, that can be treated, and treated relatively easily out of the hospital.
Interesting, very interesting. Okay, we have time for just a couple more photos. What is that?
This is another gentleman, and he is one of my favorites because he's a young, healthy guy, except for he has this terrible varicose vein. He came in because it's causing pain, but also he leads his son Boy Scout troop, and he takes him scuba diving, and he's just ashamed of the way his leg looks. And that's probably the main impetus for him coming to see me. When I saw him, I knew what the problem was almost before we did the ultrasound, and the ultrasound did also confirm the diagnosis. We were able to treat this gentleman with the venous closure and with sclerotherapy, and this is his picture 1 month later. You cannot even tell that he had that.
But the pain, and what kind of pain? Again, just heavy legs or tingling or what?
He had heavy legs, and he was an executive, and he did a lot of travel, and he would notice it when he was driving or he was in a car. After a couple of hours, he would start getting throbbing, heaviness, and swelling in his calf, and when he got out in the hotel and would elevate his leg, that would get somewhat better.
When he comes back for the follow-up, what does he say?
He says his leg feels great. He's ready to take his next scuba diving trip down to Florida with his Boy Scouts, and he was excited.
Does a lot of this spread, word of mouth spread?
It does. It does.
People with varicose veins have friends with varicose veins.
Absolutely.
Right? They all hang around with each other. I'm kidding around. But...
Well, if you just play the odds, 1 out of every 2 people that you know has varicose veins.
Is that right? Half the
right.
people have varicose veins?
Half the people have them, and you'll probably never know it.
Is that right? Okay, now you brought one more. We have one more.
We have one more here. This is a lovely lady who actually runs a horse farm, and she would be riding all day, and she'd have pain and cramping in her leg, even with the riding boots, which are fairly tight on her. So she came in to see me. When I looked at her leg, I thought I knew what the problem was, but on the ultrasound, I was actually surprised. It was actually a different source than just looking at her leg I would have suspected. But we were able to fix that. The problem was actually up high in her thigh, even though the varicose veins were on her calf. And we fixed that problem with the venous closure.
Okay.
And this is her leg a month later.
You know, that is a big difference, especially for a female.
Yes.
You know, it looks like a young leg, by the way.
She's younger than me. She's very young.
So it feels, so the pain goes away.
Pain goes away.
Right away.
Almost right away on most people. Now also, people have dark brown spots on their legs from the blood pumping out against the skin from the abnormal veins, and that usually will go away too. That usually takes about a year, but it does go away, and they all do better.
Do you ever hear, doctor, you've probably never seen anything this bad?
Oh, yes. Yeah, and that...
Or doctor, you've never seen anything like this before in your life?
Most patients think that theirs is the worst it's ever been. And,
I mean, do they say that really?
They do. They say, Doc, have you ever seen anything worse in my veins? And most of the time they'll say, oh, yeah, yours are about average. And they're very surprised.
Now, we're out of time. Great stuff, by the way. Great photos. I know you wanted to talk about this Elvis procedure, and we only have a minute or so. What is it?
Elvis is a new laser, and if you were worried about pain and bruising and swelling with the older generation of lasers, then your problems are over. This laser doesn't cause much in the way of pain or swelling. It's pretty much equivalent to the venous closure. But it does let me treat smaller and more tortuous veins than I can with the venous closure. Like spider
veins, things like that, or swirly veins, or whatever?
Well, swirly varicose veins, the big varicose veins that are sticking out, the ropey veins, The spider veins, this wouldn't be appropriate, and we do other things for that, but this will allow me to treat the varicose veins better in some patients that I could not treat before.
So most of these treatments we talked about an hour visit in your practice?
Well, when we do the venous closure or the Elvis procedure, that takes about an hour, but most of the others may just take 15 to 20 minutes, and then you're back out of the office.
Final message, though. Somebody watching this, maybe they're skeptical. They're going, I don't know, my doctor told me they have to be stripped, or they think they're too old, or whatever. What do you say to them?
Well, I say to them that we don't have to strip your veins. Almost never do we have to do that. Usually we can treat you in the office. The venous closure or the Elvis procedure may take an hour, but other than that, it's quick. If you have varicose veins, you ought to come in and be evaluated. The earlier that we can evaluate and treat you, the less problems you're going to have with swelling, pain, ulcers in your legs, blood clots, or bleeding.
So people that are in their 80s, in their 90s. You said you treated a 90-year-old?
96 is the oldest.
So she did it specifically for pain?
She did it for pain.
And how did that work out, by the way?
Oh, she loved it. She said her legs felt great. She had no more problems after that and was able to go on with her life actually a little bit better.
All right, so technology, where do you stand on technology in your office? I mean, you have the new stuff?
Oh, yeah, we do. We do. We love this, and I'm kind of a technology buff, and we keep up on all the latest. The Elvis procedure is actually a brand new laser that's kind of a third-generation laser, and it causes much less swelling and pain than the older versions. And it allows me to treat some veins on people, the big ropey veins, or some of the deeper veins that you have to use ultrasound with that I wasn't able to do with the venous closure. So I'm very excited about that.
Well, good for you. You know, and we should mention too. I mean, for people just tuning in, this is a real interview. You know, we didn't script this out or anything, and it's not an endorsement for you. But I always say, go to an expert. Go to somebody that this is what they do, because there's a lot of guys dabbling in what you're doing.
Yeah, and if you get up with one of these guys, they may be able to make your veins go away for a little bit.
Should they go to somebody that's board certified in phlebology? In your opinion?
I think so, yes.
So just ask the doctor that.
Ask the doctor if they're board certified in phlebology, which is the specialty that treats the veins. And there are very few of us around.
Okay, good. Very interesting. I want to thank you for coming on the show. Good stuff.
Thank
this will
you.
be on your website. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website. Just put in veins or Dr. Nichols, and you can see it again. And plus, it'll probably be on your website as well.
It will be.
All right. Thanks. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.